Definition of male infertility.
Good morning to all the audience. Actually, definition of the male infertility is related to the count. So it's better we define what is oligospermia. Oligospermia in 2010 has been defined by WHO if the sperm concentration and the count is less than 15 million per ml, or if basically the motility, the forward and slow progressive motility totally is less than 30%, and if the abnormal morphology is more than 4%. So we have to just have the criteria for a normal count, and anything below that, it is called oligospermia or male infertility. Or any other sexual impotence where suppose he cannot have IC with his wife, these are all coming under the male infertility.
Signs of infertility in male.
If he is not able to perform intercourse, or if he doesn't get erection, if there is a basically premature ejaculation, or if basically he has got any infection, or if he is basically astrospermia, these are all coming under category of the infertility. About 12% of all the men with oligospermia are having astrospermia. And these astrospermia are two categories. It is obstructive astrospermia or non-obstructive astrospermia. Once we do the semen analysis for the patient, and if the first report shows there are no sperm, or he's got astrospermia, then we have to repeat it in the interval of 6 weeks. And after 6 weeks, still there is no spermatozoa, then he is being labeled as astrospermic man, and we have to do the testicular biopsy. On the testicular biopsy, if it shows that he has got a sperms and intact spermatogenesis, so he will be labeled as a obstructive. Astrospermia means the pipes are closed, the vas deferens or epididymis closed. But if there are no spermatogenesis and he will be in the state of atrophy or spermatogenesis arrest or cell-to cell syndrome, then it is called non-obstructive astrospermia.
Causes of male infertility.
The main cause is basically genetic. It is genetic and genetic. So there are kind of not only genetic, it is also chromosomal aberration. We have one condition like Klinefelter syndrome, where instead of having a 46XY, they will be 47XXY. They have a gynecomastia, they have a astrospermia, or a genetic mutation also. It can cause totally astrospermia and non-development of the testicles. So these are the kind of cases where basically they will come to us with the astrospermia or oligospermia. The main reason apart from the genetic and chromosomal is a pollution. Intrauterine exposure to X-ray radiation or to any drugs. These are the kind of cases where the baby will be born with basically later on he will develop astrospermia if there are any excess X-ray radiation to the fetus in the intrauterine. And now very scaring story is coming up, where there is a large study in the forest in United States and in European countries, where many studies shows that in the forest the birds are homosexual, or the animals, there are sexual behavior, abnormal behavior are there. This is because of the too much of the xenoestrogen and pesticide in the environment. That is a reason there is an increased incidence of the abnormal sexual behavior and increased incidence of the oligospermia, because too much of estrogen in body of the men, it can cause basically oligospermia. And also if this excess estrogen in the uterus, it can also cause azoospermia in the fetus and in the adult male later on.
At what age men stop producing sperm?
There is no age limit. Men are always remain fertile. Maybe to some extent fertility potential it reduces, but they never stop reducing.
Sperm health and fertility.
Sperm health and fertility, as I told you, is related to the concentration and the motility, but there are many research shows that you will see basically a count where it is good, 60 million count is there, or motility is for 40%, 30%, but this sperm does not have fertilizing power. Where we have one test which is called zona penetration test, it is failed in the in vitro. These tests, it will indicate that these sperms do not have the fertilization power for the oocyte, and they are the one which remain to be unexplained infertility in men. Nicotine, smoking in the beginning, it caused a scenario like that. It before affect the concentration, before it affect the motility, it will affect the fertilization power. Fertilizing power and the capacity of the sperm will be affected by nicotine. Exposure too much to pesticide also can cause that. Exposure to pesticide where it is basically is out of control, now in the air, in the food, in the groundwater, in the drinking water. Everywhere we are exposed to the pesticide, and the end product of these pesticides are basically xenoestrogen and estrogen in the body. These are also affecting the fertilization power of the sperms.
How to produce optimum sperm?
Basically by a healthy, good diet, more and more vegetable and fruits, and good drinking water, and tight underwear to be avoided, because the spermatogenesis, it will happen at 36 degrees centigrade. The whole body temperature is 37, and only the testicles in men, the temperature is 1 degree lesser than the rest of the body. And if men are being encouraged to sit in the cold water daily for 1 hour, it will help and stimulate the spermatogenesis to some extent. And a lot of oxygen reducing agent, basically like vitamin C, like taking tomato, lycopene, these are all, it help in a good spermatogenesis if the problem is not genetic.
What are the fertility tests available for men?
The main thing is this semen analysis and the concentration, and of course the andrology testing is a DNA fragmentation, where it is a genetic testing and a molecular, and we will know the integrity of the DNA, sperm DNA, and if this is more than 30%, the DNA fragmentation is there, then this is also, it causes male infertility, and basically the penetration and the fertilization power, it fails.
Lifestyle factor that hamper fertility.
If too much of the fast food, obesity, cold drink, and basically sedentary work, sitting position work, like traffic police are always constantly exposed to the pollution, or computer operators constantly sitting, so it is generation of the temperature, and it will affect the spermatogenesis and basically the process of the spermatogenesis.